October is Breast Cancer Awareness Month, and today is actually National Mammography Day. There are a lot of events this time of year to raise money for this research, including the Making Strides Against Breast Cancer Walk, which is in just a couple weekends here. So joining me now is Dr. Gary Larson, who is the medical director at ProCure Proton Therapy Center, and then Lisa Foster, who's a senior director with the American Cancer Society. Thank you so much for being with us here this morning.
Thanks for having us.
Thanks for having us.
So this interview is going to hit home for a lot of people. I think I read some 250,000 women are going to be diagnosed this year. So this is a really important topic, but something to be done about this research are these walks, these Making Strides Against Breast Cancer walks. We're going to have one in a couple weekends. What do people need to know?
Yes, absolutely. So our walk is November 5th and it starts at the Adventure District. It's a non-competitive walk. So really anyone can come out and walk. You can bring strollers or a wagon and pull the kids, and there's no registration fee. So that's also good to know as well.
Okay. And tell me, what kind of research can a walk like this provide? What does something like this mean for y'all?
Well, the American Cancer Society helps fund research into curing cancer, as well as just helping patients who are going through the process of being treated. A lot of support for patients who have to come out of town for treatment, help them with a place to stay, and a lot of little details like that.
And I don't know how much money a walk like this makes, but tell me some specifics about some of those therapy treatments, you know, or how many families, how many patients could be helped by just one walk like this?
I'll let you answer that.
Our goal is to raise $100,000
from this one walk.
Yes, absolutely, and 100% of that money is restricted to breast cancer research and patient programs. So everything from new treatments and therapies to programs like our Look Good Feel Better session and Reach to Recovery that are designed specifically for women going through breast cancer journey. So it really means a lot, and that money will stay here to support those local programs.
And I believe the Tulsa Walk was just last weekend. Was that successful?
Yes, it was. It's always nice to see a sea of pink walking around the walk, and breast cancer survivors are some of our most passionate advocates because it's something that everyone can relate to, and it's a journey that women really bond over, and so our walks really bring together the community who cares about this particular issue.
Yeah, I think it's fantastic. And Doctor, I do want to ask you this question. Looking back on 2016, it's hard to believe we're about to close out the year here. What advancements were made with breast cancer? Any medical breakthroughs or trials that are noteworthy?
Well, we're working on, since we cure such a high proportion of patients with breast cancer compared to a lot of other diseases, one of the long-term problems people have are living with the side effects of treatment. And some of the main research we've been doing is into minimizing long-term complications of especially radiation therapy for breast cancer. A lot of women are cured of their cancer but may develop heart disease 10 or 15 years down the line. Proton therapy, we have 2 protocols we're working on to limit the radiation dose to the heart, but still give all the dose we need to cure the breast cancer and hopefully prevent women from having a heart attack or other debilitating heart problems somewhere down the line.
And are you seeing a lot more patients choose proton therapy as their method of treatment?
Yes, we talk to all the patients about it if they look like they would benefit from protons as opposed to conventional radiation therapy. And a lot of them are ready to jump on board and start treatment. Unfortunately, we still have to argue with the insurance companies for a lot of patients.
Sure.
But for the patients who benefit from it, we've been treating them regardless.
Yeah, I know y'all do fabulous work there at the center. Do you want to talk about the pink that y'all are wearing?
Yes, absolutely.
Doctor, I understand that you are one of the Real Men Wear Pink candidates. I understand you're supposed to somehow wear pink every day this month of October. Kind of tell us about that program that you're taking part in.
Well, I had not heard of the program until I was asked to participate in it, but the American Cancer Society, raises money for the Strides Walk, and our goal for each of the men who participate in it is to raise at least $2,500 for the program, and they gave me this tie, so they're trying to keep me in pink attire. So.
Well, you look very sharp. I like the pink for sure. And so what's the goal there for the American Cancer Society? How many of these kinds of candidates do you have doing this right now, and what's your goal with them?
Right. So in Oklahoma City, we have 12 men from across the metro area who, like Dr. Larson, have committed to wearing pink every day in October and to raise $2,500 each. So a little over $25,000 will be our goal. We're at about $6,000 right now, so we're just encouraging people to support Dr. Larson and our other Real Men in this campaign. It's something brand new for us, and we hope to grow it every year. So we appreciate this inaugural group of businessmen who have jumped on board to support breast cancer.
Okay, we're out of time, but really quickly for our viewers who want to take part in that walk,
Yes.
how do they do so?
They go to www.makingstrideswalk.org to sign up, or to support Real Men Wear Pink, it's makingstrideswalk.org/realmenokc.
Okay, perfect. Dr. Gary Larson, Lisa Foster, thank you so much for being with us here
for
today.
having
A
us.
fantastic cause that you were both standing behind.